Welcome to our body capsule channel. Today we are going to talk about obesity. So what is obesity? Or explain obesity. Slim are becoming less slim while overweight and obese are becoming more so. To understand obesity, first we need to understand obesogenic environment as it encourages eat more and exercise less. We should identify cheap and heavily market energy rich foods. Increase in labor saving devices such as using frequent number of elevators, remote controls, passive transport such as car instead of walking, cycling, etc. Before knowing our obesity, first know these things properly and then decide. First, should we eat less or eat balanced or with mixing up exercise or eats anything? Body fat distribution. Increased intra-abdominal fat causes a central, abdominal, visceral, android or apple-shaped shape which differs with subcutaneous fat accumulation causing generalized gynoid or pear-shaped obesity. Number 3. It's especially a message to a male with sudden increase in weight. Men suffer sudden fat accumulation with impaired functions in liver, pancreas, skeletal and cardiac muscles, promoting type 2 diabetes, metabolic syndrome and cardiovascular disease. The intra-abdominal fat drains into the portal vein and hence directly to the liver. Thus, many factors arise from adipose tissue, including free fatty acids, adipokines such as tumor necrosis factor alpha, adiponectin and racetinin, are at higher concentration in liver and muscle, including insulin resistance, promote type 2 diabetes. The key to remission of type 2 diabetes with restoration of first phase insulin response to glucose appears to be loss of ectopic fat in liver and pancreas. Number 4. Causes. Just like if you know your destination, then obvious, you will reach as it goes with our weight gain too. Why is it gaining? Do I eat less food? So it's happening due to some reasons. First, energy-dense foods such as drinks with highly refined sugar content and salty snacks have increased and the food disappearance rate such that productions and sales has increased for all food groups with greater consumption of catered meals and less food waste. Obesity is correlated positively with the number of hours spent watching TV screens, inversely with sleep time, and inversely with level of physical activity. Second, artificial sweeteners stimulate an appetite for more energy-dense foods. Third, BMR tends to fall and weight increase throughout adult life, such as increasing energy intake. On the other side, decreasing energy expenditure. In increasing energy intake, increase in portion size, increase in snacking, grazing, and loss of regular meals, increase dense plus added value food such as fat and sugars, increase affluence, effective marketing, whereas in decreasing energy expenditure, increasing car ownership, decrease walking to school or work, increase automations or domestic labor saving, decrease manual labor in occupations, decrease sports in school, increase time spent on computer games and watching TV, increase central heating and washing machines. Secondary reasons such as problems in endocrine or drug treatments, endocrine factors, whereas in drug treatments, worse in combinations. So first, let's talk about endocrine factors. First, Cushing syndromes, hypothalamic tumors or injury, insulinoma or hypothyroidism, whereas in drug treatments such as sodium valproate, atypical antipsychotics, olanzapine, glucocorticoids, gabapentin, pregabalin, sulfonylureas, thiazolidinediones, insulin, pituitrin, beta blocker, antidepressants, amitriptyline, mirtazapine. Obesity is not a big deal, but how? The estimated average global daily supply for food energy per person increased from approx 2350 kcal in 1960s to approx 2800 kcal in 1990s. It's all due to number of hours spent watching screens, stress for success or to achieve comfort life, decreased level of physical activity, increased consumption of food due to lack of active in kitchen or easy way to grab foods. One call and see within half an hour food gets delivered. So try to make own food. It may be anything. If we start making food, we'll get calm and relaxed as food makes our brain in hyper mode. But to cook food with our hand needs perseverance. Some genes play a bad role in our body. These genes are mutation of melanocortin 4 receptor MC4R, which accounts for approx 5% of severe early onset obesity, defect in enzymes processing propiomelanocortin POMC, precursor for adrenocorticotropic hormone ACTH in hypothalamus, mutation in leptin gene. Prader-Willi and Lawrence-Moon-Bidle syndromes. These latter can be treated by leptin injections. Let's know some investigation. Measuring waist circumference is useful with BMI under 35 per kg meter square. Above this level, it is unnecessary and becomes unreliable as the waist descends under gravity. Pathological eating behaviors such as binge eating, nocturnal eating, or bulimia demand specific management. Thyroid function test, overnight dexamethasone suppression test, or 24-hour urine-free cortisol if Cushing syndrome is suspected clinically. Type 2 diabetes and dyslipidemia, check for fasting blood sugar, HbA1c, and a serum lipid profile. Elevated serum transaminase occur in patients with non-alcoholic fatty liver disease. At last, management. Weight loss 5 to 10 kg improves all cardiometabolic risk factors and reduces the incidence of type 2 diabetes. Weight loss 10 to 15 kg or more is needed to gain remission of established type diabetes or of sleep apnea. Promoting healthy eating in schools, promoting walking and cycling options for commuters, and cooperate on a matter of mutual concern with food makers to reduce energy, sugar, and fat content and to label foods appropriately. Cornerstone of long-term control of weight is lifestyle modification, motivating disciplined eating patterns, and pre-planned meals. Increased physical activity level, younger people such as walking, cycling, swimming, etc. Very low energy diets, VLEDs, under 800 kcal per day or low energy diets of 800 to 1000 kcal per day are similarly effective for rapid weight loss of 1.5 to 2.5 kg per week compared to 0.5 kg per week on conventional regimens. A minimum content of 40 to 50 gram protein daily minimizes muscle degradations. Over 20 gram of fat helps to avoid gallstone formation with sufficient magnesium to avoid constipation and fluid intake of at least 2.5 liters per day to avoid dehydration, which can cause orthostatic hypotension, headache, constipation, and nausea. Bariatric surgery is the most effective treatment for obesity. In terms of amount and duration of weight loss, optimal dietary and drug therapy has been insufficiently effective. Severe obesity, BMI more than 40 kg per meter square, or those with a BMI more than 35 kg per meter square and a significant complication such as type 2 diabetes or obstructive sleep apnea. Although some evidence-based guidelines now suggest surgery can be considered at a lower weight with recent onset diabetes and a BMI more than 30 kg per meter square. It may not simply relate to limiting the stomach size or absorptive capacity, but also in disrupting release of ghrelin from the stomach or permitting release of peptides from the small bowel, thereby enhancing satiety signaling in the hypothalamus. Diabetes usually improves rapidly after surgery, particularly after gastric bypass, but this is mainly attributable to severe energy restrictions in the preoperative period. Increased release of incretin hormones such as GLP-1 may contribute to improved glucose control. Perioperative mortality is now under 1% in experienced centers, but post-operative respiratory problems, wound infection and dehiscence, staple leaks, stomal stenosis, marginal ulcers, and venous thrombosis may occur. Additional problems may arise at a later stage, such as pouch and distal esophageal dilatations with loss of effectiveness, persistent vomiting, hypoglycemic or hypotensive dumping syndromes, hypoglycemia, and micronutrient deficiencies, particularly of folate, vitamin B12, and iron, which are of special concern to women contemplating pregnancy. This should be delayed for at least 2 years following surgery. Treatment of additional risk. Obesity must not be treated in isolation. Other risk factors must be addressed, including smoking, excess alcohol consumption, diabetes, hyperlipidemia, hypertension, and obstructive sleep apnea. Let's follow the latest series. You will get interesting information and facts. Thank you for watching.